Hello, everyone. Thank you for joining today's webinar, Trailblazing Tech or Dodgy Device, the Future of Consumer Wearables. I'm Catherine Martucci, Director of Policy and Programs at the Alliance for Health Policy. For those of you who are not familiar with the Alliance, welcome. We are a nonpartisan resource for the policy community dedicated to advancing knowledge and understanding of health policy issues. And I want to take a moment to thank our signature series sponsors for supporting this event. Without them, this event would not be happening, so thank you. And then I also want to remind everyone that you can join today's conversation on Twitter using the hashtag AllHealthLive and follow us at AllHealthPolicy. We also want this to be an active conversation, so please get your questions ready. And you should see a dashboard on the right side of your web browser that has a speech bubble icon with a question mark. And you can use that speech bubble icon to submit questions you have for the panelists at any time. We'll collect these and address them throughout the broadcast. And you can also use that to chat any technical issues that you may be experiencing, and someone will attempt to help you. And then finally, please be sure to check out our website, allhealthpolicy.org, where you can find background materials that accompany this webinar, including slides, a resource list, an experts list, and we'll also make a recording available there soon. And now I am so pleased to introduce Ms. Adamica Arthur to moderate today's discussion. Adamica is the founding executive director of Health Tech for Medicaid, a collaborative convening of payers, providers, policymakers, and innovative entrepreneurs collectively advocating for health equity and improvement of the Medicaid program on a national scale. And she's also an experienced clinical epidemiologist and a hospital health system executive. And so with all of those wonderful experiences, we're so glad that she's here today to lead this conversation. Adamica, I'll turn it over to you.
Great, good morning. I'm happy to be here today and really thrilled to spend some time talking about this great topic with our esteemed panel. So I'm honored to really moderate this expert panel on the future of consumer wearables. As many of you know, there's a growing demand for wearables that has generated really a booming market, and how now insurers and companies are seeing how supply of wearable technology can be beneficial to not only their customers, their employees, but also other larger consumers. And as a market, the US consumer use of wearables has increased from about 10% to well over about 37% in just the last few years. And this number will continue to grow as wearable technology becomes more conventional. So we are going to talk about this today, and we have here with us today to further discuss this case are a group of esteemed experts. First, we have Dr. Brian Kelly. He is the president of Payer and Provider Solutions at IQVIA. In this role, Brian helps to set and execute the strategy for using technology to accelerate IQVIA's leadership in the clinical research and provider market space. Prior to joining IQVIA, Brian was the head of informatics at Aetna and also worked at Accenture, where he led his global electronic health record practice. Dr. Kelly is a former Navy neurologist and an intensive care medicine specialist. Next, I'm pleased to be joined by Dr. Jasmine McLean. She's senior manager at Avalere Health, where she advises clients on digital health strategy and quality improvements implementation. She draws on her deep expertise in oncology research, innovations in virtual care, and provider strategy. Prior to joining Avalere, Jasmine was associate director at advisory board, where she advised senior leaders in hospitals and health systems in devising long-term operational strategies related to digital health and healthcare delivery transformation. Next, we have Dr. Van Krishnamurthy. He's the CEO of Tactile Navigation Tools, and in this role, Dr. Van designs and engineers assistive technology to improve mobility for those with visual impairments. He previously was the founder of Trinomics and head of clinical research and operations at TrailSpark. And finally, to round out our great and amazing panel this morning, we have Ms. Christine Monkhouse. She's the CEO and founder of Patient Orator, which is a digital health startup that is using a mobile app to help underserved patients document their medical symptoms to empower their voices in their health expertise. She's a public policy expert and former healthcare frontline staff who saw the urgent need to build the bridges between communities and healthcare. She's also a patient advocate, on a mission to dismantle systemic inequities that cause health disparities across our healthcare ecosystem. Thank you all for being here with us today. I'm going to start off with an opening question to Dr. Kelly. Dr. Kelly, I'm going to start with you. Good morning.
Good morning.
From your perspective and leveraging your expertise, what is the most important for healthcare professionals and policymakers to know about consumer wearables for health?
So thanks, Adamica, and good morning, good afternoon, everyone. So I wanted just to start by talking a little bit about what is a wearable and just sort of baselining it for the conversation today. So very simply, a wearable is any device you wear on your body. This would be in contrast to implants that are implantable. Now, there are many types of wearables. Wearables can be medical devices. For example, a hearing aid is worn and is a medical device. If you were to wear an external vest that had a defibrillator attached to it, that would be a medical device. But there are many other type of wearables that are consumer devices and are not medical devices. Great examples of these would be a smartwatch or a fitness tracker that you might use. Now, it gets a little complicated here because that consumer device, that smartwatch or that fitness tracker, you could run an app on that. And that app, which runs on a consumer device, could be a medical device. So, you know, it gets a little gray here. Now, what makes something a medical device as opposed to a consumer device? Well, you have to go and ask the FDA, and the FDA is very clear about this, okay? Any device that is intended for the use in the diagnosis of disease or conditions or in the cure, mitigation, treatment, or prevention of disease is a medical device and typically would require approval. So the key concept here is that app, is that consumer device, is that wearable, is that being used to diagnose or treat disease? If it is, it's a medical device. If it's not, then it's a consumer device. Now, the FDA has established classifications for about 1,700 different categories of generic devices. These fall into three major categories, what are called Class 1, Class 2, and Class 3. Class 1 are things like syringes and bandages, pretty simple type of stuff. Class 2 is a little bit more complicated device, like a mercury thermometer. Class 3 device would be something like a pacemaker that you would implant somebody. Now, why is this important? The regulatory process for getting approval of medical devices is based on class. For classes 1 and 2, you would typically go through something called a 510K clearance, whereas the Class 3 device, typically you go through what's called pre-market approval application or PMA. Now, wearable devices are not regulated by the FDA if they're intended for general wellness purposes, such as maintaining general health or general fitness. But this is where, again, it gets a little complicated. So let's say it's the 1st of January and you make a New Year's resolution that you're going to get fit again. You go to your fitness club and you get on a treadmill or you use a stationary bicycle. Well, that stationary bicycle or treadmill may actually record your heart rate and tell you that your heart rate's 120 when you're exercising. Is that a device? Is that a medical device? The answer is no. It's a consumer device because the intent of that heart rate measurement is to basically promote general health and wellness and not diagnose or treat disease. Now, in contrast, let's say that you have a smartwatch and that smartwatch has an app on it, and the app on it is specifically designed to detect an abnormal heart rate so that you could maybe it could signal you that you want to go see your doctor to get checked out. That app would be considered a medical device because it is being used for the purpose of diagnosing or potentially in some other cases, treating disease. So general wellness is in the consumer device area. Apps that basically do diagnosis or make suggestions around treatment are not. Now, these different wearables support thousands of apps. I mean, you can go to the App Store and look, and you will find thousands of apps that are in the medical area. And generally, if the app is making a specific recommendation or diagnosis, the FDA is going to want to take a look at it and qualify it as software as a medical device, and there will be a regulatory implication. However, if you want to know, does your app need to go through this process, or is it more in the general wellness category? There's a great website if you just go to ftc.gov, the Federal Trade Commission's website, and just type in Mobile Health App Interactive Tool. I'll say that again, Mobile Health Interactive Tool. It takes you through a series of questions, very simple to answer, and then it tells you whether your app would likely require FDA approval or if it's what's called minimal risk to users. And the FDA has decided if it's a minimal risk app that they're not going to regulate it. It doesn't require you to go through an FDA approval process. And things like this are things that would help a user self-manage their disease or condition, maybe help a user organize their healthcare data, allow them to see their electronic health record data on their smartwatch or other device and things like that. There are other examples, but you can go there. So, Adamica, I hope that gives you a little bit of a overview of what is a medical device, what's a wearable, what's a consumer device.
That was excellent, Dr. Kelly. All right. Well, next I'm going to bring up Dr. Jasmine McLean, and I'd love for you, Jasmine, to give similar kind of an overview from your perspective and leveraging from your own expertise. What is most important for healthcare professionals and or policymakers to know about consumer wearables for health?
Thank you, Adamica, and thank you, Dr. Kelly, for that great overview. I think that's really helpful and sets the stage for our discussion today. So as we think about the use of wearables in health and healthcare, I think it's really easy to sort of think about the devices as a one platform fits all solution, right? That we're all excited. We love kind of the user interface and thinking about these gifts as the holiday season is approaching. But I think it's really important to kind of categorize the intended use when we think about the devices. So I wanted to dig into that a little bit more along with the considerations as it relates to data privacy for today's discussion. I think there are a lot of exciting opportunities when it comes to patient engagement, but I think one thing we're really seeing is that there are new and I think tougher challenges when it comes to data privacy and data security as it relates to the use of wearable devices. And so, you know, it can be a bit overwhelming, I think, as you kind of think through some of the things that Dr. Kelly was talking through about the uses. So I want to break those up into a couple of categories just for the purposes of discussion. So if you think about wearables that can be used as a tool for kind of self-driven or individually initiated behavior change, those are the really exciting fitness trackers like Fitbit that I think a lot of people really enjoy. And that's an example that can help both patients who are relatively healthy as well as patients with perhaps a variety of chronic diseases to promote physical activity through the gamification that we've seen in health and wellness. And so I think there where we hear a lot of questions from providers is, what do I do with that information when a patient comes in and they're really excited about how they've been using their Fitbit or have information that they want to share? What does that mean in terms of any care planning or decisions that I might make with that patient in partnership with that patient? And so the data is just really messy, right? It's hard to understand exactly what that means in terms of any changes in a patient's care plan or how to discuss that in a way that is both helpful to the patient and doesn't add too much burden on the providers on the provider side. The second category that I like to think about in terms of the uses for these devices are devices that can be used to help with symptom or disease management. And so an example there that I think is really smart is an example where Apple Watches are being used to help track tremors for patients with Parkinson's disease. And so you can imagine a world where prior to the use of an Apple Watch, you might go in, you know, every month, every couple of months to see your neurologist, but you wouldn't be able to necessarily have objective data to share with that provider about how your tremors might change over time since the last time that you had seen your provider. And so the Apple Watch is a way that you could perhaps track the tremors over time time, and then use that as a tool to talk about perhaps how your disease is progressing as a patient with Parkinson's disease. And so I think that's really important because the level of granularity that you get in terms of the data with the use of the device is completely different than what you would have had access to before. Again, I think there are challenges when it comes to the reliability of the data, as well as thinking about how does that get integrated into the care planning process with a provider. And then the third category that I think is really important is tools that are specifically used to inform shared decision-making between a patient and a provider. So something I'd put in that category is a continuous glucose monitor for a patient who might have diabetes, using that as a way to modify a patient's treatment plan and think about how you can discuss treatments that might be available for that patient, but as well as behaviors that are happening outside of the four walls of a hospital or a clinic. So I kind of wanted to just walk through that because I think sometimes when you talk about wearable devices, the number of applications can be really endless and I think exciting, but it's important to kind of think across those categories. And so you can have devices that serve more than one use, but the threshold for evidence generation and then also the regulatory oversight that is being applied, as Dr. Kelly described, is very different. And I think it should be different across those three categories. I don't think anybody would disagree with the statement that we have challenges with very traditional forms of healthcare data being shared and managed across what are called covered entities, right? So thinking about hospitals, pharmacies, health insurers. And so that only gets magnified when you start to think about the number of new entrants who might have access to health-related data that is not covered under HIPAA. So I really want to start to think about that in the context of this discussion, not only with the new forms of data and the new entrants, but the new ecosystem of data that we're starting to create with all of these devices, right? So you have wearable devices that are really exciting and being used along with a smartphone or a smart speaker, right? So you're seeing all of these new devices coming and lots of data emerging from each of those. And so I think where I'll end is just really making sure that we start to keep front and center the intersection of technological literacy and health literacy when it comes to these devices, of making sure that patients and particularly vulnerable populations understand the capabilities of these devices and then how those can be used to help inform their own health and care planning. So I'll stop there and turn it over to the other panelists.
There were lots of gems in there. I mean, even I was writing down some of the things you were talking about, like gamification and how our new ecosystem is there. So thank you so much. Really insightful thoughts. So now we'll turn it over to Dr. Van. Good morning, Dr. Van.
Morning.
From your perspective and leveraging from your expertise, which is pretty vast, what is the most important for healthcare professionals, which you are one, and policymakers to know about consumer wearables for health?
Thank you all, and thanks for the question. And it kind of building upon what Dr. McLean had said in terms of that intersection between the patient and every other stakeholder in digital health. So whether that's clinicians or the pharmaceutical developer, the device developer. So if I step back for a moment, I kind of come from all of those perspectives. So I started off really as a radiologist in academic medicine at Yale and Columbia, and then I thought I could do more in big pharma. So I spent some time there, and that kind of gave me that perspective of being on the other side of the table of the patient. And it really made me realize that we kind of have the power when we're not the patient, when we're the physician, when we're the nurse, when we're the drug developer. We have a lot of power in really shaping people's lives. And so along that process, I actually was diagnosed with retinal degeneration from a really rare genetic mutation. And so, I'm slowly losing vision, and I'm actually currently, testing wise, considered legally blind. And so it's really opened my eyes, pun intended, to what it's like to be the patient. After I saw the world experts in retinal diseases, they did amazing testing, diagnosed as genetic workups, and then it was kind of like silence. Like, what do I do next? There's no real connection to the rest of the community, the world, whether it's services, social work, devices, and so on. And it really, really hit home that connection between the patient and the other stakeholders, it really doesn't exist. We have to build some real bridges between all of those until we can empower the patient, empower someone like me. And so that's where I went into the startup world and developing devices to help folks who are visually impaired. And a lot of that is navigating what requires the FDA and what doesn't. I'm definitely on one extreme of data and privacy. I believe the patients really should own their data, should be able to benefit from the data they're paying for, all the testing and care they get, and that yes, security is important, but unfortunately, there's a lot that's not being done because of the fear of security. And so I actually think it's worth pushing those limits and sharing our healthcare data so that devices can be built. And along those lines, the other important part that I learned, from being in big pharma, at least when I was at Bristol Myers, we did an excellent job of understanding the patient, right? So we had patients come in with the disease we're trying to treat or cure, and we had them on panels and really tried to get in their shoes, even though we didn't have the disease. And I think that perspective of the individuals most affected and most in need and most vulnerable should really be designing the solutions. And in digital health, it's actually possible. So, we've developed a cane. It does not require FDA review. And, as a visually impaired person, I was able to actually directly test, understand, refine that product and know that it could have a real value. And as we kind of expand into the more digital electronic devices and for our second product, that's when we'll have to get involved with the FDA. But again, being a person who's visually impaired, I think is critical to designing the right product, because otherwise at some level, we're always guessing what the patient needs.
Wow, really powerful and well needed. I mean, I think the perspective of being an entrepreneur, but also additionally being a patient and understanding things from the patient perspective is really important. And that's a great segue to our next individual on our panel, Christine. Christine, good morning.
Good morning, Adamica. Thank you so much for having me.
Yeah, so from your perspective and leveraging your expertise, what is most important for healthcare professionals and policymakers to know about consumer wearables for health?
Sure. So through the lens of both the patient and the caregiver, I echo most of what the panelists have mentioned, or the previous panelists have mentioned. Through that lens, there's the pros of the opportunity that wearables present, especially as we look towards measurement of data and collection of data that is otherwise lost outside of that clinical setting. And much like what we've done with our app is look at how we can leverage qualitative data, data that will help that patient improve their health and their well-being, both in and out of the clinical setting. I think the argument can be made that wearable offers innovative ways to connect with the patient and strengthen that relationship with the provider, but more importantly, improve patient engagement in the management of their health and healthcare. But I think where the con lies, and I think these are things that we need to think about, not only from a policy perspective, but also from a clinical perspective, is those little issues. And I call these bucket item issues. One being access, right? So specifically, when I speak, I'm always advocating for our underserved and chronically ill population or people. So when we look at low-income individuals, especially those who may not have access to purchase those devices, who already have the burden of out-of-pocket costs and medical fees and other payments pertaining to their health, we have to be careful about this issue of accessibility. Keep in mind, if the device requires the individual to have a wireless plan, that also adds to the cost burden on the individual. So the other piece of that, I think one of the previous panels mentioned, was the issue of literacy. And when we look at health literacy and how that impacts communication, I think there's been studies that's proven that literacy actually, or low literacy, can actually lead to more hospitalization, especially for our low-income patients. And then the last piece, I think, would be around the issue of privacy and concerns around privacy protection for patients, and that data that's being collected, the patient-generated data specifically. So I think there was one study that was done by Rock Health, which stated that people are more trusting of the federal government and insurers and big pharma than they are of big tech. So I'll leave it there.
Thanks for these comments. They're really just an insightful panel this morning. So I want to thank the panelists for getting us started and kicking off what's important to know. We're now going to move into the Q&A discussion for today. Remember, you can use the questions panel of the audience interface to submit your questions at any time. And I'm going to start with a few questions that have already started coming in for our panelists. So what responsibility do companies have of ensuring the equitable and safe use of data? And not just making sure that data is secure, but also making sure that it's not abused.
Hi, can you hear me?
I can hear you just fine. Do you want to go
Wonderful.
ahead, Dr. McLean?
Yes, so I think, that's a great question. And I think it's something that really goes back to what we were talking about earlier as it relates to how this data fits within our existing regulatory framework across healthcare. And so it's really challenging because a lot of these entities are not covered by traditional, things like HIPAA. They're not covered by that. And so I think what we've seen is a move toward self-regulation in the absence of kind of a clear framework for how this will be applied to these new companies, these startups and tech companies that are really getting into healthcare. There has been a push towards self-regulation, but I think there are a ton of challenges there, which I'd love to hear some of the other panelists' thoughts on in terms of what does that mean for how an organization's incentives to be involved in health and health-related data. How does that align with the ability to self-regulate? I think that's going to be a really challenging issue as we continue to see the use of these devices emerge across the market.
Jasmine, if I could just add on to what you're saying, I think you teed it up beautifully. Just for the purposes of the audience, just because this I don't think is always widely understood, is that the HIPAA law that's been around since 1996 only applies to entities that are providers of healthcare, payers of healthcare, or clearinghouses, which are basically the organizations that move claims data around and do things like that. If you are not one of those three entities, then the HIPAA rules, which I think is actually a very, very good framework for protecting the use of healthcare data and striking the right balance between being able to use it to deliver great healthcare and do great research, and at the same time protect the patient's rights to privacy and confidentiality. It's a great framework, but it does not apply to organizations that are not payers, providers, or clearinghouses. So the real question is for all of those other entities that are not part of that group, what is the framework? And right now, there really is no US countrywide framework for doing that. The Federal Trade Commission basically has broad consumer protection rights, but it hasn't really defined in great granularity what that means. We do not have a industry agnostic government framework for privacy in the United States, and that's a little bit where I think some of the tension is.
Great. I'm going to move on to the next question. It's a very million-dollar question. Are these technologies actually helping individuals improve their health, or is improving access to otherwise inaccessible or unaffordable approved medical devices? Anyone want to chime in there?
So this is Van. So I can chime in a little bit. I think it depends on what type of device. So, for the things we're developing, as a visually impaired person, I can tell you I personally benefit from the devices we're developing. So the answer in that sense is yes. I think if you look at things like Apple Watch and the Samsung Watch and sort of the whole fitness industry, there definitely is a gap between measurement of parameters like heart rate and blood oxygenation that the watch can do and what the fitness person or the trainer is helping the wearer do. That connection back into the healthcare system doesn't really exist. There's a little bit of that in terms of some insurance companies are basically helping people to subsidize the cost of a watch so that they can plug them into, let's say, going to the gym every month, and then they might subsidize the cost of the gym. But I think fundamentally, and a little bit to differ from what Dr. Kelly is saying, fundamentally, I think the way to approach this is really not helping the patient and the patient, whether it's heart disease, diabetes, eye disease, whatever. I think we have to go back and basically say, the patient is spending a lot of time and money to get healthcare, and how do we add value to that process to the patient? Just like with insurance payments, we have value-based payments saying you have to actually prove your diabetes if you want to get paid for caring for a patient with diabetes. I think we have to apply those same principles. You actually have to prove that the device is helping improve health. You actually have to get people to design a device that helps the individual patient and their characteristics. So I think the data in terms of ownership, patients should really financially and medically benefit from sharing their data. Right now they don't, because it's done through this premise that as we basically are giving our data to whoever wants to use it, there's an IRB process that'll review that proposal. There's a HIPAA protection, so in case that data is lost, but the patient who actually paid and got that testing really benefited in no way from that. I think we have to really change that paradigm. So the patient's data has to really be in the control of the patient. The patient can share it if they feel like it's going to benefit them. And then when they have that tangible sort of skin in the game, then they'll help to design better products, and they'll help to connect all those stakeholders like the trainer, because those different worlds all come back to the patient. They don't come back to the healthcare provider or the drug developer. They come back to the patient.
Yeah, that brings up a really great next point, privacy, right? Privacy is a big issue. What do you guys view as the most important areas, or what stakeholders need to be engaged in this privacy conversation today?
Yeah, I'd love to jump in there. I think one of the, challenges, even as I think about this within healthcare, but I think, as you talk to friends and colleagues outside of healthcare, understanding that digital footprint of what does it look like to have this surveillance-based model in a lot of ways of devices being used in your home, going to the gym, in different, in the grocery store and the pharmacy, right? So you start to understand what does it look like to have information about you being shared across multiple entities. I think that is going to be something where we really need to focus and elevate, as this series is intended to do, elevate the voice of the patient and center the design of these devices, the use of these devices, and the application within healthcare settings in particular around what is going to best serve patient needs, and how do we ensure that patients understand how their data are being used, but more importantly, I think in the world of big data, how is that being aggregated to paint a picture of your health? I think that is really important to consider, to think about how do we educate and partner with patient populations, because a lot of times it can feel very top down in a lot of ways of, hey, this is what's happening in the industry, this is the direction that we're moving toward innovation. I think it's really important to just continually bring patients to the table as we develop new ideas and innovations around the use of these devices.
I'll jump in if you don't mind, Adamica. But what I'll say is, as someone who lives with chronic pain and who interacts with healthcare providers on a regular basis, but also working with chronically ill and underserved patients, I think we shouldn't underestimate this issue of trust, which goes back to this issue of transparency. So we need transparency not only from big tech, but also from government, insurers, payers, all of the different stakeholders that will be regulating and or allowing data to move as it should to benefit the patient and the health outcome of those patients.
That's great. Now a question about payment. Flexible spending account dollars can be spent on preventative items like sunscreen, neck pillows, and even lip gloss in some cases, right? Why can't you spend your FSA dollars on wearable devices that have proven medical benefits? And I guess the question is that both preventative or therapeutic medical benefits. Shouldn't Congress act to correct this and update the status or the statute for modern prevention and treatment? I'm sure you guys are all going to jump in on that one. Who wants to go first?
I can say a little bit. So I think the bigger problem is where's the money coming from and where's it going? I think to expand the FSA, we're basically in a sense giving a tax break for a certain segment of the population, and then we're cutting revenue for the government to provide services, let's say through Medicaid, to another segment of the population, because let's be honest, Medicaid recipients are not getting FSAs because they can't afford to. They may not even have an employer that offers it. So I think there's a bit of health equity in that loaded into that question. I think it's we who are privileged get to benefit from an FSA, whereas the wider population doesn't.
I also think, Adamica, I had spent a couple of years at Aetna, and part of my role there was to sort of evaluate the value of different programs and services. And if you think about what any of the payers do, and they often administer the FSAs on behalf of employer groups and the government and others, is part of their charge is to basically determine what does get paid for and what doesn't. And they really do try to apply a lot of thoughtfulness and due diligence to this. I can tell you this because I sat on panels with many other doctors and other clinicians that were doing this. And because the bottom line is that there's not enough healthcare dollars to go around for everybody. And we want to make sure that healthcare dollars are being spent on things that work. So part of the challenge is, when is the body of evidence good enough to show that this device, this app, this wearable works in this patient population to do that? So a lot of this is going to get down to the demonstration of value. I think Vance's comments before about tying this back to outcome-based, value-based payments is where everyone would want to go. But this is a journey, and it's going to take time to evolve and to catch up and have the basis of knowledge that says we really should reimburse this type of app, this type of thing, because it adds value in this patient population in this particular instance.
And just to level set for the audience, most individuals who get FSA accounts, which are flexible spending accounts, they're under the age of 65 and they're employed, because you kind of can't qualify if you are on Medicare, and most people over the age of 65 enroll in Medicare in this country. So it does leave a very large subset of the population, about 120 million, 130 million, maybe 125, 130 million people without any sort of a vehicle like that. They're also, the thing about FSAs are that the person, your employer, owns and provides access to what you get in your FSA. So good information. Let's talk a little bit more about data. If consumer-generated data could integrate with provider systems, this would be a great way to start tracking patients' reported outcomes. Is anyone doing this that you guys are aware of?
I think that's where Apple and Google want to get to. And so, with HealthKit and the other systems that they've built up to try to open those data pipelines, I think in some sense, they've given up on the healthcare system to open the data pipeline. So they're creating apps to pull in that data through their devices, through the phones. And then that's where they're going to start modeling. And it's, they already have the engineers to do the modeling and then to go to the next step of actually building some machine learning and AI out of it. And so I think it'll come more from, honestly, big tech than it'll come from startups innovating and big tech acquiring those startups than it will from the healthcare systems.
And Adamica, part of this is going to be just driven, again, this gets back to, what are people incented to do and how they are incented to act. It really does get back to value-based care. Right now, our delivery model for healthcare in the U.S. is still very provider-centric. It's basically more, I have a problem, I go to a doctor, they try to solve the problem, but I'm, as a physician, I'm usually paid for the transaction as opposed to the outcome. Now, if you really want to get into outcome, you could see how valuable it would be to integrate clinical healthcare data with social determinants of health and other behavioral aspects into things that really drive behavior that's going to impact particularly chronic disease. And if we could bring them together and leverage them and tailor the treatments to that using that model, I think we'd be better off. The problem is who is incented to collect all of those additional data sources, because I've been in healthcare IT for 25 years. it is not easy to bring all these data sources together for many, 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 many reasons. So again, I absolutely agree that we're seeing big tech try to solve the problem and try to enable solutions that make this more easy to do. But the integration is going to require a redesign of how we finance healthcare and deliver it.
Yeah, and I think you bring up a really strong point. Go ahead, Jasmine.
Well, I was just going to add to what Dr. Kelly was saying. So I think, one thing that I hope as we continue to move through this pandemic, as we start to think about ways that you can leverage data to engage with patients and to sort of make clinical decisions without having a patient physically in front of you. And so I think we've seen a lot of, expansion in terms of openness to telehealth. I think we're still sort of tracking some of the trends as it relates to the adoption and the sustainability of those platforms being used over time. But that is one thing that I hope to see. There have been examples here and there. There's a ring, I believe it's called Aura, where you can track sort of temperature for a patient, and thinking about how that might be able to anticipate a diagnosis of COVID using data like in that way. And so examples like that, I hope that we continue to, as a healthcare industry, think about how that could be applied more broadly, how there are applications that could specifically target the needs of patient populations with chronic disease or vulnerable populations that don't have the same level of access to care. I hope that spurs some creativity as we think about how to sort of move through the next months and years.
I'll jump in.
And that's a whole other topic, right? When you look at the COVID deaths and you look at access specifically in both tech equity and health equity, as kind of compares to like telehealth and telemedicine access to communities. Christine, did you want to join in?
Yes, as the startup on the line, I would say that that's exactly what we've done, having built out a mobile health app that not only measures or collect data, patient-generated data specifically around the clinical aspect of what clinicians need, but also that social determinants of health aspect. And in my conversations with payer systems who are now trying to get ahead of how do we do this, a small startup has done that. Our next challenge is how do we integrate the data that we're collecting from the patients into these systems and have that data be incentivized and have a behavior change be incentivized, and also using machine learning in that process. So I'm excited for what we're building, especially as it pertains to improving health outcomes of our underserved patients.
Yeah, that's a great way for us to talk a little bit about, people, right, and compliance, right? Are we seeing with wearables any sort of compliance with treatment in the use of wearables? Anyone seeing anything out there?
I'm not sure if I've seen anything related to treatment per se. I think one of the things I think about a lot is the reliability of the data. So I love to share the story when I talk about sort of wearable devices with clients. Is I have both of my parents are very avid Fitbit users. They love their Fitbits, but sometimes they wear each other's Fitbits. So my dad will be walking around and he has 2 Fitbits on his arm to make sure that they hit the goal for the day. And I think about that example a lot, because how are you able to use the data in a way that is going to be meaningful and help to impact behavior change, number one, for a patient, but then also think about how does that sort of align and integrate with the clinical data that you're generating at your doctor's office. And so I think that's a place where the challenges only are going to be exponential as we think about adherence to treatment, of thinking about ways that you can start to track medications, things like that are going to be directly applicable to the decisions that you would want to make as it relates to a patient's healthcare. We really need to, sort of identify tools and strategies for communication that will help leverage these devices as tools, but not rely on these devices as a sole source of truth when you think about how do you inform a patient's care plan.
I love how in the beginning you talked about the gamification, and now you're talking about your parents' gamification of the Fitbit.
Yes, absolutely. Gaming the system, as sometimes we would say.
Well, I think
go ahead, Dan.
I think that Dr. McLean pointed, something she said earlier, I think will start to solve what she brought in with her last comment, which is the use of video. So telehealth. So, for the vision impaired community, I can tell you, like I and many others who are vision impaired, telehealth has been a huge help, because most places, including healthcare facilities, really are not accessible to people who can't see well. And so using video calls to interact with healthcare providers was a huge help. And the segue into something she mentioned about the video as well is that is a huge set of data. And it's not just in health. So if you want to look at social determinants with, my son goes to school remotely, we're going to keep him on that because, he has ADHD, and it's actually been really beneficial for him to be able to be at home and sort of regulate his day instead of being in a classroom that's just overstimulating. That video right now is not being analyzed or used, but it's a gold mine for trying to build algorithms based on, you have an outcome, right? In school, it's a grade. If it's a telehealth visit, the outcome could be, analyzing the features could be analyzing facial expressions to look for depression, or to look for something that could happen in the future and sort of proactively intervene on that. So I think that the use of telemedicine, the use of video is huge, and again, to tie into those other stakeholders in the retail space. So one of the things in our second device is that we use a whole bunch of sensors to basically help people navigate, because they can't, for example, I'll give you my personal example. When I go to Whole Foods, I have to use my phone constantly to zoom in and magnify to find out, where's the organic marshmallows, and whereas, for everyone else, they see it, so they don't need to do that. And so, our devices use a whole bunch of sensors. It'll tell me where that product is. It'll do text to speech to tell me the product's there. It'll recognize the face of the person who's the expert in marshmallows at that Whole Foods. And so if I have any questions, it'll say, hey, Ben is over there. You can ask him about the specific thing about marshmallows. So my dog's name's Marshmallow, so I think that's why I thought of marshmallows. But anyway, so I think that use of sensor data, video, everything else in all of these realms is going to be huge. In the healthcare realm, telemedicine, in the retail world, just in terms of devices we wear and what it's picking up as we go to retail spaces, into the clinical trials, to see where people are going, what they're doing, what they're eating, let's say, to match that into the efficacy results, and also into the school space or into the churches or wherever we go that influence us on a social side.
Well, the expert of marshmallows in our house is my 4-year-old, so I totally get it. Let's talk a little bit about digital therapeutics. What role do payers, particularly government payers, play in ensuring access to prescription digital therapeutics? And then if we get that question down, how do we think that access challenges confronting prescription digital therapeutics are different than other access challenges for other like FDA-cleared devices?
So
go ahead. Sorry.
I'll make a quick comment, but then I'd love to hear from Van and Jasmine and others on this. I think that the way payers will look at this is the first is they'll want to see, does the digital therapeutic impact an outcome in a positive way? I mean, you've got to there needs to be a body of evidence that demonstrates that. And that's the same bar as for a non-digital therapeutic, for any therapeutic. That, and in my opinion, whether it's a digital therapeutic or a traditional therapeutic, the same framework should be used for evaluating it. Now, I am sure that there are all sorts of societal barriers to access for digital therapeutics for different groups that I think we collectively have to really address in a much, much better way than we have. But in terms of general frameworks, we should evaluate digital therapeutics on their value, just like we would any other therapeutic.
Who else wants to chime in on this juicy bit of digital therapeutics?
Well, I think I would say there's just a lot of exciting, sort of new initiatives emerging as it relates to behavioral health, mental and behavioral health. I think that's where we'll see a lot of applications of the intersection of digital therapeutics and other traditional types of therapeutics sort of come come to fruition. We have our devices with us all the time. You have your phones with you, your smart speakers with you. And so I'm really interested to kind of follow how we can use these devices in new ways to have access to information and sort of thinking about how do you engage with patients in a way that meets them where they are. And that's particularly important when it comes to mental and behavioral health. So I think about something like using voice as a digital biomarker to be able to track a patient's, the progression or perhaps a new diagnosis of something like depression or anxiety. There's some work being done there. So I think we're going to see a lot of really exciting ways that we can use digital to kind of advance some of the work as it relates to mental and behavioral health diagnoses. And that's a real challenge overall, but I think especially has come more to the forefront over the past year.
Great. Anyone else want to chime in? All right, let's move on to another question. We talked a little bit about patient use of wearables, and we certainly heard Jasmine's parent story about wearing their Fitbits so they meet their neighborhood goals. Are there any incentives that you guys can think of that give people like an incentive to continue to use a device on the long haul, or like to use it at all?
I think that's a big issue because Fitbit's own data shows that there's a huge drop off after the first 6 months that someone buys a device. And so I think I clearly have biases that are coming out as my comments, but I think this is where big tech is really going to take the lead because I don't know about you, but do you notice how much the notifications, emails, the other things that I get, and I'm sure you get, to keep me on Instagram? I mean, it's really quite crazy. And then even the ads that they show me, right? So that targeting and sort of some of it's gamification, and some of it is just really understanding me, the user, and what'll keep me engaged. So I think that's what's going to be needed for a lot of this to keep it sticky. And so in the technology world, right, the word sticky, like it's sort of built into the process, right? I'm sure as a startup, you also understand this as well because you're experiencing this. Investors, right? You won't get your next round of VC money if your product's not sticky. It's just not going to. You're not going to be able to show that growth or that outcome or whatever it is that you have to do to get that next round of funding. It's just easier to build that into the tech model. So that's where I think big tech's going to drive it.
The other place I think where big tech can happen, we use all sorts of wearables and devices for a lot of our clinical trials that we run at the company I work for. And what we've actually found is exactly what Van was mentioning, that retention and continued use of these devices is a challenge. The more we can passively collect information that doesn't require people to actively do something, that's going to be the real step change in us being able to use these as what I'll call monitoring devices in a good way, not in a Big Brother way, but in a good way. And I think that is really where the opportunity is. Now that's going to take a little time to evolve, because to really be able to use things like Jasmine mentioned around voice or tremor or gait, which a lot of these sensors and smart phones can do very, very well. We need to correlate that with clinical disease so that when we see this as a digital biomarker, we know that this other clinical event is happening. There's a whole body of very exciting work going on there, but it's a journey, and we're not there yet. As we get to these passive collection of data that doesn't require me to do something 5 times a day or respond to an alert, we're going to be in a much better place. So it's coming, and it's going to be an exciting time.
All right, we're nearing our, oh, go ahead.
One final comment there. I know we're getting close to time, but I think this is also where it's important to really think about how clinicians play a role. There's data that shows that patients do really respect and value the opinions of their providers when it comes to the devices and things that they're using outside of the hospital or the clinic. And so thinking about ways that you can use the time that a patient has with a provider to enhance that stickiness of the device, right? So if there's a way that is being integrated into the discussions that they're having, perhaps that patient is more likely to use the device longer than the average, whatever it is, 4 months or 6 months that they typically would if they just walk into the store and buy it and come home. So I think we want to really, be thoughtful about how that integration is happening among the different stakeholders between patients, providers, social groups that I think Van mentioned of interacting with churches, faith-based institutions, really thinking about how you start to create an ecosystem based around health and wellness that includes clinicians, but doesn't only center at the hospital or the clinic.
That's huge. I mean, the churches, right, with the Barber study for heart disease and hypertension, high blood pressure, that was amazing. The results that were shown, everything from cholesterol going down, diabetes, sugar levels going down, blood pressure going down, and that's all was enabled by churches and barbershops, and because that's where the patient is. And so, I mean, I think that's an example.
I just want to throw out one last question to you guys all, just one quick round robin here, because I think this kind of wraps up our day around, how will the continued and increased use of consumer wearables in health impact the digital divide that we've kind of, circled around a little bit today?
Sure, I can start.
Yeah.
So I think my hope, and I'm a very optimistic person, my hope is that we're able to use these devices and the access overall to new types of technology within healthcare as a way to reduce bias, as a way to have more information about patients and their lived experiences that will help improve clinical decision making and treatment planning for patients, rather than a way to sort of broaden that digital divide that we're seeing. And so if there is an opportunity to really keep the vulnerable populations as it relates to chronic diseases or patients with lower socioeconomic status, really make sure that they are at the forefront of the design and innovation of these new platforms, I think it will benefit all patients, and I think it will benefit the healthcare industry as a whole.
Any other thoughts before we wrap up?
That's spot on. I can't agree more. I think in tech, it's UI UX, right? User interface, user experience. I think and then in clothing, there's this sort of FUBU or for us bias concept. I really do think it has to be for us bias. The patient has to be designing, has to be involved in that innovation, involved in the iteration, involved in the trial design, the trial follow-up. All of that has to be really done and centered by the people who are affected by the disease of interest.
I'll jump in and I'll say I agree with both of the panelists on that. I think that we have to think about this idea of collaboration, not only from the patient, but also the caregivers. And when we think about underserved patients in particular, the social workers and the other clinical team and the providers. So I think that's a part of the narrative that needs to be bridged also, in addition to that patient voice.
Great. Well, this has been the most exciting portion of my morning and your guys' afternoon. I want to thank all of you for your insights on this very important topic. I think this is all the time we have for today. I think we could be talking about this for many more hours. So I want to thank our panelists for joining us this afternoon. I want to remind the audience to take time to complete the brief evaluation survey that you're going to receive immediately after the broadcast ends, as well as you'll get it later on in email. And then I wanted to give a couple of opportunities. So when we talked a little bit about telehealth equity today and Health Tech for Medicaid, which is the organization I run, we have a very large telehealth equity campaign to make sure that more than 1 million individuals get access to telehealth services across the country, specifically in communities of color, which have been the hardest hit by COVID-19. And you can certainly go to our website and learn more about that. But there are work groups in which you and your staff and others can impact policy and change the way we're thinking about things, certainly as we move into a new wave of administration. And the Alliance is going to be hosting an upcoming event on COVID-19 vaccine deployment, which we all know is the top of mind conversation. They hope to explore the most recent science on the vaccine candidates and how that may affect supply chain logistics, how industry stakeholders are preparing for vaccine deployment, and the immediate steps that these stakeholders will take in the first kind of 48 hours after emergency use authorization has been approved. Additional details will be announced soon on the Alliance website. So please sign up for that, because that's another area where we really need to make sure that we have all voices, really curbing the divide and changing the course of direction of the vaccine availability. And the Alliance wants to really hear from you. They want you to fill out their audience survey. You can tell them what you'd like to see in 2021 programming. And a recording of this webinar and additional materials will be made available on the website. Dr. Kelly, Jasmine, Van, Christine, thank you very much for joining us. And I want to thank you all for attending today.
Thank you, Adamica.
Thanks.
Thank you, Adamica.